Okay. Well, hello there. Welcome to Kate's Corner. We have a special guest today. Why don't you introduce yourself? Yeah, your name's Maya. Say hi. Hi. Yeah? Okay. Maya's going to help me today as we talk about prostatitis. Yes, it's a very serious disease. Okay, great, let's get started. But first, let's have a stare down. Oh, she's not going to do it. There's a gland in the reproductive system called the prostate. It's located right here. It's in the male reproductive system. It's located next to its neighbor, the bladder, right there. Now, when the prostate gets infected, it gets inflamed, which means it gets bigger, right, Maya?
Yes.
Yeah. Okay, so when it is diagnosed, it becomes prostatitis. Now, its meaning is prostatitis. Broken up, it's prostat, which means prostate, plus itis equals inflammation, which is prostatitis. Prostatitis! Take care of that. So, there are different types of prostatitis. There's acute, right? Prostatitis right there, you know, and it's pretty small. It's the least common, and the symptoms are pretty severe. The symptoms are having to urinate quite frequently during the night, and also, hang on here, change it up a little bit. That's better. Okay. Now, hang on here, okay? Okay. So, it's urinary frequency urgency. Need to urinate at night, okay? And have pain in the pelvis area in the male. Only males get prostatitis. So, you also get pain in the pelvis and genital area, okay, as I said. Often, you get fever, chills, nausea, okay? Vomiting and burning when urinating. Not so much fun, hey? I know, that's a hiat. That's mom's hiat. Okay. Now, there's also chronic prostatitis. Are we going to do it? Chronic prostatitis. Yeah, thank you. She's a very good helper on this little acute prostatitis here. Now, the results of chronic prostatitis are quite the same, but they do go undiagnosed with anything. We're good. See, acute, severe pain. See, we're showing severe pain right here. This acute prostatitis, see? Okay, now, the result is reoccurrent UTIs. UTIs, also known as urinary tract infections, okay, that have entered the prostate gland. It is said that some men, it can exist for several years, as I said, before producing symptoms. Symptoms are similar rather, okay, to acute bacterial. Okay, prostatitis. There we go. Okay. Acute's taking a break here. Okay. Now, the diagnosis is often challenging. It's difficult to find bacteria in the urine when you have this chronic Prostatitis. Antibiotics you usually get prescribed for 4 to 12 weeks. And pain is, you get pain medication as well. Okay? Oh, yeah. Okay, so sometimes men are given a suppressive low dosage, long duration antibiotic therapy. I will explain that in detail in my essay. Okay? Alright, so next we have one that is the most common. Hi. Okay, so it affects 90% of all cases, and it's marked by UTI, urinary tract infection as well, and genital pain. Okay, oh, let's just do this here. Read it. You want to read a little bit there? Oh, there we go. Okay, there. Say hello to our viewers. Okay, that's okay. Oh, so, it's the most common, this last one here. 90% of all cases marked by urinary and genital pain for at least 3 of the past 6 months. Patients show no bacteria in the urine, but may have other signs of inflammation. Conditions may be confused with interstitial cystitis, which is also known as chronic inflammation of the bladder. Now, if it affects, now, let's get back over here, okay? Let's stand in your spot. Oh. Yeah, this means the acute prostatitis is kind of everywhere. Oh, okay. No, thank you. Now, it does affect men of all ages, usually young to middle-aged men. Okay. And, now, I forgot to wear my gloves, so I'm not going to show you the procedure. But a doctor performs the digital exam, DRE, by inserting a glove lubricated finger into, it's not fun, I know, into the rectum just behind the prostate. The doctor can feel prostate to see if it's swollen or has tender spots. The doctor can diagnose the bacterial forms of prostatitis. Little thing's gone here. Okay, by examining a urine sample with a microscope. Now, that's all we're going to talk about today here on Kate's Corner about the prostatitis here, okay? But there will be more in my essay. Thanks for listening, and you have a great day, okay?